to a couple quick notes before we start. This session is being recorded, and you can drop questions in the chat. Alex and I will help monitor that throughout the talk. Today, we're joined by Dr. Abby Morris, MD. Dr. Morris is the Senior Director of Health and Clinical Strategy at Maui Calm Project and the former Medical Director of the IAFF, the International Association of Firefighters Center of Excellence, a leading treatment facility for first responders. She trained at Cornell University, Georgetown School of Medicine, and Johns Hopkins Hospital, and is double board certified in psychiatric and addiction medicine. She's been a physician for over 24 years and has spent the last decade working with more than 4,000 firefighters. Her work focuses on PTSD, addiction, anxiety, and trauma recovery in first responders. Today's webinar, Responding to the Emergency Burnout and PTSD. She'll be sharing how float therapy supports recovery from PTSD, anxiety, insomnia, and addiction. She'll also talk about how float center owners can connect with local fire departments to bring this work into their communities. When I started putting together, I got charged with picking speakers for this year's float conference and doing some quick research and talking to Justin Feinstein, who most people in this community are aware of. He suggested Abby Morris, and a quick research. You were quickly on the top of my list of keynote speakers I wanted to get here. I've wanted to do a better job engaging my local fire departments. We have a lot of fire rescue firefighters, EMTs, first responders who float with us, but there's nothing organized. And if I could clone myself for a callback here, one of them would be knocking on the doors of all the fire departments and convincing them why this is so important. But that's why I felt like bringing Dr. Morris in to help give us some additional information, empower us to having these conversations would be great. So, Dr. Morris, we're really excited to have you. I'll hand it over to you.
Thank you so much. I really appreciate this invitation to speak because it gives me an opportunity to talk about this amazing group of people that I care so much about, which are the first responders, firefighters. This is a very introductory talk, a teaser, shall we say, for September. And I'll give you a lot more information at the conference in Norfolk. As you said, I've been a psychiatrist for over 20 years. The last 10 as the medical director at the center, which is a very unique center. It's really the only place in the country, if not the world, that is a place that's only for first responders and focuses on mental health and addiction for them. And when we opened, I knew because of this unique group, and I'll talk about why they're unique, we needed to have complementary, I call it complementary versus alternative or complementary therapies versus just talk therapy or medication. And I looked for evidence-based complementary therapies and came across float, and it has been an important component of what we do at the center. That and stellate ganglion blocks have been really important for our firefighters ever since we started using them. So that's how I came across Justin Feinstein, and that's actually how I ended up going to Maui. For the last 6 months, I took a sabbatical, worked with Maui Calm, became their one of their executives there, and I have since resigned as medical director and moved to Maui. So I am now, we're really working full time with float and trying to bring float not only to Maui, but around the world as an important part of PTSD treatments for disasters and also as preventative. So not going into any more of that, but I'm going to speak to you today to help advance your understanding of this really unique subset of patients. And by doing so, help you to connect with them in order to bring them the amazing benefits of float rest therapy. I might mention things that you already know about float rest, but in a way of connecting you to first responders. So I think we need to share my screen so that I can do a PowerPoint. And I promise it'll be a little bit interactive. So can I hit the share and then do that? Can I try it from my end? Like you're muted, so I can't hear you.
I am muted. My dog started getting excited. You have the share button there? You should be able to share.
If it works, let me see if it works. It doesn't work. Oh, wait, share. Okay, share screen. And then let me go to the PowerPoint and do from the beginning. Okay. So can you all still hear me? Okay. So I'm going to put this thing down if I can figure out how to. And I'm just going to go from here. So I won't be able to see you or hear you. So I'm going to go from here.
I'll chime in if there's any questions
Um,
or anything along the way.
oh, please do. Okay, good. I can still hear you, which is good.
Okay,
So
yeah,
obviously
I'll
this
keep
is
an
a
eye on
talk.
the chat and see if and I'll chime in.
Okay. I will tell you, I want to warn people, there are some things that might be triggering in this talk. I am going to talk about things like PTSD and suicide. So if that's something that might be an issue for you, that you may want to step off this talk or be prepared for things like that. But I did want to mention that. So a unique treatment challenges of working with firefighters. We have chronic or complex PTSD, and I won't get into why it's different, but it is different from classic PTSD. um, Firefighters have very erratic sleep because of their shift schedules and for other things I'll get into. They have chronic pain, caffeine overuse. They are overprescribed stimulants. That's the doctor's fault to help with the effects of this erratic sleep. They use overused testosterone and they abuse testosterone. They have binge eating issues. They have sex addiction, gambling addiction, porn addiction, social anxiety. People are actually surprised to hear that that is one of the most common diagnoses for firefighters is social anxiety, codependency, suicidal ideation slash moral injury, stigma, and refusal to ask for help. Now, I'm going to, I highlighted the first three because they are the most connected to float rest and the central nervous system activation. So I'll focus on those three in this talk the most. So, why float therapy? Well, we need alternative and complementary treatments because if we survey firefighters, 71% will say they have not used the services provided by their departments. If you talk about EAP, um, if you look at what's provided to them, they will say they will not go to EAP. And if they have used EAP, 63% will say they have not found it helpful. So they did survey, the IAFF did ask their firefighters, are you aware that you have EAP and other services available to you? And almost 90% said yes, we are aware that we have psychiatric and therapeutic services available to me. Have you used your EAP? Was the next question. If you look, no. Almost 80% said no, I have not used it. And if you have used it, did you find it helpful? And almost 70% said no, I have not found it helpful. 83% of the surveyed firefighters said that they feared that if they use this and they got help, they'll be seen as weak or unfit for duty if they ask for help. And the biggest concern, like I said, 83% said they're afraid of looking weak. 70% were concerned of a cultural stigma around mental health. 60% were worried that if they stepped off and they got help, that their colleagues wouldn't trust their judgment under pressure. And 46% were concerned that they'd put their job at risk and they would not be allowed back on the job. And I can tell you, having treated 4,000 plus firefighters, that some of that is actually true. That it is harder after they get mental health care to get them back on the job. You can't work harden people back to being accepted back on the job, and they are looked at a little differently. So this is Paul Coombs. He does a lot of really great firefighter cartoons. He says this firefighter is being drowned by his pride. I don't need help. I can rescue myself. And meanwhile, he's got the sharks of PTSD and marital stress and suicide and depression circling around him. So let's look at the central nervous system activation as it applies to PTSD. Watch a little video here.
I'm not hearing the sound.
Oh, you don't hear the sound?
No, it might in the share settings. Hold on a second. You might, how do you share this? Alex, do you know how to share this?
Because it will be important, if not for this one, for later
Yeah,
videos.
I
Because
know we have some other videos on
mm-hmm.
Zoom.
There's
Uh,
a tab on the top of the screen that says Abby Morris's screen. Is it maybe in your settings there?
I'm looking here. Let me look at share settings. Hold on.
To share, click the green share button, screen share button, then click the share sound box in the bottom left
Okay, bottom left. I don't see.
corner of the selection window. When you do, maybe stop sharing and then choose to
Okay,
share again, because I think it's when you hit the share and the window pops up and you choose what to share. In the bottom
okay.
left, there's a little box to check.
Oh, share sound. Okay, share sound. Okay, okay. Let me try again. Let's see if
Thanks
this
for
works.
bearing with us.
Sorry, guys. Let's try this video again. Can you hear it now?
Yes.
Basically done, so I'm gonna come off of this. Um, but what you see is, can you hear me now?
Yes.
Okay. It is a hard job. This being a firefighter is an incredibly hard job, and you can actually see even in that video, it is put out. That was put out with one of the fire departments, actually, a peer support team, and you can see the activation even there. He goes into the fire. He has a traumatic incident and can't sleep, and he is angry, and he is irritable, and he's isolating. And in that video, they are recognizing that, and they're asking all these firefighters to get help, to recognize the signs and get help. So they did a survey. It was actually, I think it was NBC and IAFF did surveys. 95% of firefighters say that they have experienced critical stress on the job. And about 75 to 80% believe that that critical stress on the job has caused lingering, unresolved emotional issues. And about 20% will have DSM diagnosable PTSD at some point in their career. And that is 2 to 3 times higher than the general population diagnosed for PTSD. And it's about equal to, if not higher than, for Afghanistan and uh, uh, for wars, for veterans. So, traumatic memories. Stress hormones activate the structures in each side of the brain called the amygdala. The amygdala plays a crucial role in storing the memories of emotional events, and it also activates the brain structure called the hippocampus. So, what happens to the brain when you have PTSD? They've looked at PET scans and MRIs, and what happens is the hippocampus actually shrinks and it actually gets physically smaller. And that is a part of the brain that distinguishes between past and present memories. So that accounts for flashbacks. If the part of your brain that deals with time all of a sudden isn't working well, you cannot tell if that memory where you were unsafe is happening now or happened in the past. And so you have these incidents where you feel unsafe currently, even though you are not in that unsafe place. You have increased activity or the amygdala actually gets larger. And that area helps us process emotions and is linked to fear response. So it is larger, it's hyperactive, and it's putting out signals you're in danger, you're in danger, you're in danger, more active, more often. And there's a part of your brain called the ventromedial prefrontal cortex, and that shrinks. And that's the region that regulates negative emotions. And it helps you to regulate when something happens, how you relate to it or how you respond to it. And if that gets smaller and cannot function well, then you don't respond well when you have triggers. So there's a stress brain loop. If you have chronic stress, you have something like inadequate sleep or poor nutrition or emotional distress. You have an increase in glucocorticoids. You have cellular changes like we talked about in the hippocampus. you have a decreased ability to regulate that cortisol, which again causes more increase in glucocorticoids. And then there's a loop that happens. So what happens is you have decreased attention, decreased perception, decreased short-term memory, decreased learning, decreased word finding, all of these things. And you end up in the stress loop that with blood sugar issues, trouble sleeping, hunger issues, inflammation, brain fog, memory issues, poor digestion, exercise intolerance, dry mouth, blood pressure dysfunction, high heart rate, and sexual dysfunction. And I'm going to get into this just a little bit more. And I know you're aware of these things, and I know that float rest actually does target many of these things. So if you talk to firefighters, first responders, police officers, many of them are going through all of this. They may exercise and they still are gaining weight. They're exercising and their hunger is off, and they're not sleeping, and they're not able to manage blood sugars. Many of them have high lipids and diabetes. So here, effects of PTSD. It's not truly attention deficit disorder, which is a problem because similar doctors to me are overprescribing stimulants for that they think is ADHD. It's not. It's just decreased attention. They end up with high blood sugars, diabetes, chronic pain, liver disease, and hypertension. So what are the physiologic effects of PTSD on the brain? We saw in that little video that anger and irritability, but it leads to domestic violence and road rage and bar fights and yelling at your spouse, children, and crewmates, depression and anxiety, loss of interest in activities, ruminating thoughts, poor sleep, and addiction because you turn to drugs, alcohol, gambling, porn, video games, the sex, porn, and food, which I will explain to people like, what does that have to do with PTSD? And the brain fog? Because if you looked at that brain loop that we talked about, I'll actually go back up here. There it is, a decreased attention, perception, word finding, and learning. So there's actually cognitive issues that come with that. They include the brain fog. Okay, so here it is. So we know about the sympathetic nervous system. We know that float rest targets that sympathetic nervous system and can modulate the sympathetic nervous system. If we don't have something like float rest to do that, we have a sympathetic nervous system that's really out of balance. It's high, 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 high. Well, our bodies are here, our brain's here to keep us in balance, right? Tire function is, well, let's have these feedback loops to keep us in balance. So let's say we don't have something like float rest, putting it into balance or modulating that. Well, the brain will do it for us. So the balancer of sympathetic nervous system or fight or flight is the parasympathetic nervous system. So the body will push us to do something to get into parasympathetic nervous system. So what is that? It's feed and breed, which is why so many of our first responders are having issues with binge eating. What's the trope of a first responder, of a police officer, of a firefighter, that they're over there at Dunkin' Donuts getting a coffee and a bunch of donuts? They're binge eating. They're trying to get into balance of that sympathetic nervous system. They're feeding themselves or they're breeding. And a lot of them are having porn issues and sex issues. That sexual addiction comes from that balancer of that sympathetic nervous system. So here we are again. So what does the fight or flight have to do with the first responders? The cortisol levels, that fight or flight, the anger, irritability, the poor sleep, the brain is on alert, ready for battle, the adrenaline's causing the heart rate and blood pressure to accelerate. That sex or porn, that feed or breed is balancing that fight or flight. Depression and anxiety, people are feeling out of control. They feel weak, demoralized, and hopeless. People are turning to drugs and alcohol and other endorphin rushes to get relief from anxiety and also to help with sleep. And that brain fog that we talked about in that prefrontal cortex. So anxiety and sympathetic tone. The nature of a job of a first responder affects sleep. Not just the shifts, but the trauma and emotional stress will leave some with that Rolodex of thoughts, which makes it difficult to settle a person's brain for sleep. With PTSD, the sympathetic nervous system is activated. It's unable to reset properly, leaving some in a constant fight or flight. It's unable to convince the brain that it's safe to close your eyes safely. So that's the Rolodex. This is what a firefighter is fighting when a firefighter, a man or woman, is trying to get to sleep. And that's Tuesday, but Wednesday, or Thursday or Sunday. Firefighters with PTSD are 6 times more likely to attempt suicide. And that's a really amazing statistic. This is David Robert Dangerfield. He was 48 years old. He posted on Facebook in October of 2016, PTSD is real for firefighters. If your loved one is experiencing signs, get them help quickly. 27 years of deaths and babies dying in your hands is a memory you will never get rid of. It haunted me daily until now. My love to the crews. Be safe. Take care. I love you all. And that was the last thing he posted before he shot himself in the head and he took his life. This is a guy who, it's a picture of him right there. He's happy. He loves his job. He's in his uniform. He wanted people to understand the consequences of the job that he loved on himself. And he wanted to make a difference with the death. So he posted that. He wanted people to understand PTSD. If you compare firefighters to the general population might think about suicide or have an ideation, 6 to 14%. Firefighters, almost 50%. The general population plans a suicide only 4% of the time. 20% of firefighters plan a suicide. And then 2 to 9% of the general population might make an attempt on their life. And 16% of firefighters make an actual attempt. This is a video that is a news story that was done on a friend of mine, Joe Terry. See if I can get it to go. Let's see. If I can't get this one to go, it'll be okay because I will play this in September. It is a very good video, but it often gives me trouble when I'm trying to play it for. Oh, try it again. Hold on, let me try it one more time because I do think it's an important one. There we go.
First responders, those who dedicate their lives to helping others, are not getting the help they need. There's a stigma, a fear surrounding mental health. Because of it, people are dying.
This week, we are dedicating a team of journalists to investigate the effects of post-traumatic stress on first responders. Brooke Hash takes us to Covington, Kentucky.
It's a chapter of Joe Terry's life she tries to keep closed. But the memories of her late husband, Chip, carry open wounds. She had no idea the burdens he carried during his 26 years with the Covington Fire Department.
I just assumed he was dealing with it.
Fast forward to his retirement speech in 2012.
What people don't see at 3 o'clock in the morning is when a young lieutenant has to put 2 toddlers and their grandmother in a body bag. You know, a 16-year-old boy hangs himself with an electrical cord. How do you close your eyes at night after you do that? You make that run. You know, I've seen people shoot themselves in the head. I've seen children beaten and burned.
A chilling tale of what life is like as a first responder, and yet Joe admits most who heard it then believed it was just part of the job.
Even then, in 2012, we weren't talking about post-traumatic stress in first responders. We weren't. I never heard of it. I didn't hear of it until 2017.
That's the year he checked himself into a hospital for suicidal thoughts. Chip spent a few weeks in counseling and was given a business card of someone who specialized in PTSD. A week later, he was dead.
Committed suicide.
Joe says he'd bought a gun in secret, using a credit card they never used.
And I said, I'm going to bed. And he said, don't wait up for me.
The next morning, a knock at the front door.
I saw 3 men in suits. And I knew. I just said, tell me he's okay. They couldn't. How did I not help him? The pain, it must be. Inside of them to want to give up. That I have been his partner for 31 years. And I didn't recognize it.
The truth is no one did. Mental illness did not come up in conversation before Chip's death, but it does now.
You can see that the culture's already changing. Now we're much more apt to talk about our feelings. We have a bad run, we're out on the floor.
Joe has made it her mission to change the course for other first responders who need help, but don't know where to find it.
Alcoholism, divorce, Infidelity is huge in this population of people. Well, why? It's because they're trying to cope with mechanisms that really aren't the answer to their problem.
Last year, more firefighters, EMTs, and police officers died by suicide than in the line of duty. You didn't hear about it because departments don't release details, and less than 5% have suicide prevention programs.
We owe it to these first responders to get them the mental health that they need. And the only way I feel like we can do that is with awareness.
Okay, sorry guys. I know this is tough, but it really is important to understand this population and why it's important. So this gentleman, Fire Chief Chip Terry, actually had treatment. So he actually went to treatment. They gave him a therapist card, and that was what he was offered. Those were the treatments at the time. Now, Joe Terry is a friend of mine. The Chip Terry Foundation actually does fund people to get stellate ganglion blocks and float rest because she believes in it as strongly as I do. And it is hard sometimes for people to afford these things. And so she understands the importance of firefighters getting treatments that they need, even if they are not covered by insurance companies. So just wanted to make sure that people understood the importance of what we're doing. So understanding central nervous system activation when it comes to erratic sleep. So sleeping positions, according to your profession, that's how soldiers sleep. That's how students sleep. That's how doctors sleep. Well, that's how firefighters sleep because they don't. So physical manifestations, fatigue and sleep disturbances. So when you have a chronic CNS activation, first responders tend to have fatigue, disrupted circadian rhythms. That's because they work 24s or 48s. Often they live above their means financially, so they're taking extra shifts. They have hyperarousal, and the hyperarousal inhibits transition to deep sleep. So even when they do fall asleep, they don't transition into deep sleep. And the deep sleep is where you start to go into REM sleep. Without REM sleep, you actually could die. And these guys and gals, if they do fall asleep, are often sleeping very lightly. They don't sleep heavily. They don't get into the dream sleep. One, because they think that the alarm, the tone is going to go off at any time. It reduces daytime alertness. It increases their accident risk. They are basically driving drunk because they're driving sleepy. Nearly 50% of emergency personnel report significant sleep-related problems, which affect health and job performance. So if you were to sleep test, do sleep testing on firefighters, you would probably find that more than 50%, have a sleep-related disorder. So why are there problems in sleep? We talked about the shift work, interrupted sleep, calls, noise, the caffeine, group sleep quarters. And then, okay, so the departments thought, we're going to fix the group sleep quarters. We'll give people individual rooms. So when they're building the new fire stations, they started giving people individual rooms. Well, what happens when you have individual rooms and you have a porn disorder? Well, not helpful. They weren't getting any sleep. Respiratory issues, so COPD, sleep apnea, that's because of smoke inhalation and respiratory issues, chronic pain, and we talked about anxiety and sympathetic tone issues. So reliance on energy drinks. So but not just firefighters, but in the world, there are 400 billion cups of coffee consumed yearly. Coffee is single-handedly the most popular drink on the planet. There's not even anything that comes close. After crude oil, and we know how important that is these days, coffee is the second most traded commodity in the world. That tells you the value it has to humans. Well, firefighters drink on average 4 to 5 cups daily, depending if it's a shift day, which is equal to the maximum dose of caffeine. Too many firefighters are prescribed stimulants, as we talked about, for attention, concentration issues. That's likely caused by sleep deprivation and not ADHD. And when they are prescribed these stimulants by doctors who don't understand first responders, it exacerbates anxiety and sleep disorders and irritability. So loud, erratic tones and lighting. And we don't think about lighting when it comes to fire stations, but it's actually a big deal. So noise triggers a startle response. And that startle response increases blood pressure. It increases intracranial pressure and sweating. So let's say you're asleep, if you can fall asleep and you're a firefighter, suddenly from zero, from quiet, a loud tone goes off. It's not gradual. It's quiet, and then it's a blaring alarm. Every time a blaring alarm goes off, that repeated startle response fuels cardiac risk over time. Some stations now have more gradual tones, but for the most part, it is a startling tone that goes off. So white lights, so bright or blue or white lights, decrease melatonin production. We've learned more about that with cell phones, but we don't think about that when the tones go off, the firefighters run out into the hallway where there are bright white bluish lights. So fire stations are now starting to put red lights, as you can see in that one picture, to try to keep the amount of melatonin killing lights for firefighters. But when you have to go fight a fire, you are going into regular communities where there are lights and bright lights. So the use of red lights in fire stations as the alert or after a tone can help decrease sympathetic tone and cardiac stress and may increase the melatonin, but there's only so much that departments can do to help with that. Sleep disorders, they're 2 times as likely to be in a motor vehicle crash, 2 times as likely to report falling asleep behind the wheel, 2 times the risk of cardiovascular disease, 2 times the risk of diabetes. We've talked about that a couple of times, and 3 times the risk of depression, anxiety, or addiction. And it's not just about mental health. The shorter you sleep, the shorter your life. So 45 to 60% of on-duty firefighter deaths are cardiac deaths. We used to blame that on heart disease, but an international study concluded that sleep deprivation increases the risk of a cardiac event by 46%. And I'm not going to read all the small print. I want to go across and look at cancer. If you look at cancer, routinely sleeping less than 6 to 7 hours a night demolishes the immune system, more than doubling your risk of cancer. So the last sentence down there in the corner says, in 2020, the IARC classified shift work as a probable carcinogen. So these poor guys are going through a lot. So moving over to central nervous system when it comes to pain. So these guys have a lot of pain. There are fire ground injuries. So the most common one is overexertion and strain. They have to pull very heavy hoses. If anyone's ever seen a hose, seen how the diameters of these hoses and how heavy they are, then fill it with water and then try to pull it. There's a lot of overexertion. Then if you have a medical call, you might have to carry a 300-pound person on a very heavy stretcher, then a very small, long set of stairs. You might have to carry people down ladders. You might have to carry the ladders or move the ladders. You might have to break open doors. So there are with axes, and very heavy axes at that. So overexertion and strain is a big part of it. Fall, jump, slip, or trip. Very much if you're a Minnesota firefighter and you're using water to put out a fire, you end up with ice. So there's a lot of ice falls. There's a lot of falls and trips when you go into a dark building that's been on fire, the electricity goes out. Then you're sent in to find people, children or pets, that are oftentimes hiding under beds and in closets, around corners, and you end up falling through floors, down stairs, and over things. You have exposures to chemicals, radiations, burns, fire products, extreme weather. You can get struck by something that falls on you. You can have contact with objects that swing into you. You can be burned yourself and you can be electrocuted. And I have seen all of those things. So these firefighters have every right to have a lot of pain that can be helped with float rest. Occupational hazards. If you look at all other occupations and you compare the workers' compensation claims from all other occupations to police, fire, and ambulance, and we're talking all other occupations, mining, construction. I mean, it doesn't even compare to first responders. All right, so let's get to the heart of it, the meat of it. Float rest and first responders. How do we ease the burn of the burnout? So again, common triggers of CNS activation in the emergency scenarios. You have life-threatening situations. You have environmental stressors. You have cognitive load and decision-making, and you have the physiologic stress response. We need to use float rest to reduce the CNS activation and promote recovery. Float rest therapy reduces sympathetic activity, it lowers heart rate and cortisol. It induces parasympathetic dominance, and it restores the autonomic balance. Float rest enhances mental resilience and emotional regulation. Regular float rest practice improves emotional regulation, reduces anxiety, increases mindfulness. It enhances that prefrontal cortex activity. We talked about the brain that shrinks in that prefrontal cortex, and we now know that float rest can enhance that prefrontal cortex activity. It supports better stress response and emotional control. Mental resilience, improved mental resilience helps first responders manage trauma and reduce PTSD risk. It improves the physical well-being and sleep quality. So it helps with pain. It reduces hyperarousal for insomnia, promotes deep relaxation, lowers muscle tension, the blood pressure. It improves subjective sleep quality and reduces fatigue in high-stress individuals. So how do we integrate float rest into wellness programs for first responders? More than 50% of firehouses have gyms or exercise equipment. I would say it's probably closer to 70%. This sample workout schedule came from Firehouse Magazine. Monday, do your upper body and strength training. Tuesday, you can do your cardio. Wednesday, do your functional training. Thursday, do your lower body. Friday, do your stretching, yoga, light cardio. And Saturday, it's recommended, Saturday and Sunday, to do rest or active recovery. What if Saturdays and Sundays could be float days? And that could be part of that rest and active recovery. So this was a video that was put out by the fire departments, telling you that if you value your physical health, it's time to value your behavioral health, because it's just as important as that physical health. Hi, guys. So you can see most of those things that they're addressing in there can also be discussed. Oh, well, let me forward here. There we go. Discussed with fire departments as part of the benefits of float rest, the activation, the sleep deprivation, the irritability, that sort of that activation that they talk about. The behavioral health has to be seen just as important as the physical health. So when you're approaching people and they're saying, listen, this is important to you, what are the benefits of float rest? To stress the fire departments, to stress the first responders, what I tell them is this is evidence-based. This is rooted in science. There are no drugs. There are no side effects. You don't need a prescription. You don't need to talk about your feelings. You don't need to talk about your traumas. You do not need to see a therapist or psychiatrist to get a referral. You can help your physical, right? You're floating. The pressure is off of your joints. It's off of your muscles. You're sitting in those Epsom salts. There's well-known physical positive effects, and it will help your physical as well as your psychological traumas. Practical considerations. So that's the positives. These are the positives that you need to be telling them, but these are the things you need to think about if you are going to be working with first responders. So practical considerations for implementation of bringing float rest to first responders. Accessibility and scheduling. You have to ensure that your float center is accessible and that scheduling accommodates shift work for broader participation. So if firefighters want to use a float center after a really long shift, they get off at 7 in the morning. So you have to be open at 7 or 8 in the morning. You can't, open up at noon, and you might have to be open late. So let's say that somebody wants to go before, you might have to be open at 7 or 8 at night. And if you're working with, say, a facility like mine, we made a partnership with a float facility in Virginia, but they had to finish their programming, their mental health programming, and it didn't finish till 5 o'clock. And then we had to get people in the car and drive them to Virginia. So the float center stayed open late just for our firefighters. And it was a great collaboration. The float center got to have people coming there and using the facilities, and they got paid for their services. And our guys got to use the benefits of the float, but they had to make some accommodations for us. So you might have to do that. You might have to accommodate shift work schedules or accommodate if you're making collaborations with other facilities. You need to educate the first responders with the things that I'm talking about today. You need to educate about therapeutic benefits, increase acceptance, and the effectiveness to get the effective utilization, cost management. You're going to have to manage the therapy costs carefully, ensure affordability and the sustainability of the programs. The group that we worked with, because we were bringing people fairly regularly, and patients were paying out of pocket, they kind of gave a deal. They gave us sort of a package deal. How many firefighters came, they got a lower rate, and they gave us a few free every month in case a firefighter couldn't afford it. It's not covered by insurance, as you know, but it can be covered by health savings plans with a letter of medical necessity. So what we had, what we would have, and what I would suggest to you is write the letters for the doctors, have them ready for a signature if that's required. So if a health savings plan wants a letter of acceptance of a letter of medical necessity, write it for the doctor. And then all the doctor has to do is sign it, and the patient can hand it in, and it's easy. Don't ask the doctors to write these letters. They won't do it. Privacy and comfort. Firefighters in general are not shy people when it comes to like stripping down and getting into a float tank, but people with PTSD sometimes have had sexual trauma. Many of our firefighters have had sexual trauma in their childhoods, in their adolescent years, and even as adults. And so they have issues at times with privacy and comfort. But there's also a privacy issue with going to a float center to get treatment. Again, the stigma issue can become an issue. So you want to make sure that privacy and comfort. You also have to be very careful about talking about other firefighters who go there. Oh, he's loving this. You can't do that. You can't do it. You just can't talk about other firefighters who are using your facility. They may talk about each other, but you can't do it because of the stigma. So stigma is a big deal. Collaboration with appropriate mental health professionals. They may not want to go to see a therapist to talk about their problems, but they may want to talk to you about their problems. They may want to talk to you for hours about their problems. And they may say things like suicidal thoughts. They may say things like they are having trouble sleeping or they're very, very depressed. And so you may want to have prepared some referrals to available, local, accessible, trauma-informed therapists or psychiatrists in the area if a mental health or addiction issue is suspected. So that you can say, hey, hey, Joe, I hear you and you sound like you're really struggling and you've been doing great with float, but maybe you need a little bit more. Maybe, there's a great guy in the area that some people I know have been using, and maybe you should just give him a call. You might want to have those things available. And be respectful not to offer supplements such as CBD and THC products, even if they're legal in your area. So we had an issue with one of the float providers that we were working with, that our guys would go and they'd be on the shelf, and the cashiers behind the counter would be like, oh, you have knee pain? Oh my gosh, you should try this salve. It's got, CBD. It's great. No problem. And our guys would come back from the float center with all these supplements that we would not allow at our center and that are not allowed in general for firefighters. These men and women are operating under stricter contracts and under DOT standards. And even though you do not think that this is going to make them test positive, it will make them test positive. Even some of the topicals can end up showing up in their blood. And if you give them a supplement and you're not sure it's going to make them test positive, you cannot offer it to them. They will lose their jobs, and you will feel mighty bad if you offer them a supplement that you think might help them with their pain or their discomfort, and you made them lose their job. So it is really, really important, and be respectful not to offer products, even if they're legal in your area, to any of these guys, because they're operating under much stricter rules. Collaboration. If you want to have more business and you want to collaborate, you might want to reach out to groups that are working with trauma patients, working with medical providers. I'm talking about people who are treating medical providers, air traffic controllers, pilots, veterans, police, fire, prison guards, domestic violence patients, and eating disorders. Because these are groups of people who can specifically benefit from float rest. All right. And it's 6:55, so I didn't do too badly. I'm going to stop sharing. I will leave this on for just a minute here in case people have questions later. You can always reach out to me. That is my cell phone number. You can text that number. You can call that number. That is my email. Please be sure that you say Abby Morris, MD. There is another Abby Morris out there at Comcast who gets mighty pissed off if you email her. So it's Abby Morris, MD at comcast.net. And I'm going to stop sharing in case there are questions so that I can answer them. How about that? All right.
Yeah.
Fabulous. Thank you.
You're
Yeah,
welcome.
thank you.
There's
Lots of
gotta
great
be some
information
questions.
there.
Yeah, I have one.
Yeah.
Is there a public resource right now that you recommend us pointing people to for this kind of information?
Which part of it?
I guess if I were to go approach any of the local fire stations here,
Mhm.
I mean, is it generally best to provide a printout flyer of some kind, or is there a website that I can point them to, or am I kind of on my own?
Probably gonna have to make it. Probably gonna have to make one.
Okay.
And I would recommend making one, for the benefits of float for first responders. You're welcome to have my slides. I can provide them to Matt, and you can use any of that. But you probably want to come up with something really, really easy to read, short. They're not going to read a lot.
Right.
They're not people who want a lot of information.
Awesome.
They
Yeah,
like
and that's
little
where
short videos.
I'm there. You get one. I feel like you get one chance. I'm gonna walk in there and I'm gonna pitch it, and they're gonna say no thanks, and then I'm gonna leave, and that was my one shot. So that's why I'm so excited to have this conversation with you
Yeah.
and get some of these resources. And I'm hoping that this is recorded. We'll probably edit it down a little bit and have some bite-sized quotes of it. Is some of the intention to be able to use. It would be great if you could share the slide deck, or even just so we have that information to create our own slide deck. But
I think the most important thing is no drugs, no side effects, scientific, it's science-based. You don't have to talk about your feelings. It is, you get some instant relief, which I think is important too. These guys love shortcuts. My God, these guys love shortcuts. And it's not that they're bad, not that people are bad, or it's just that they're in pain, they're suffering, they need help now. And anything they can have to give them help that's not going to give them a side effect, that is a positive. And so to get some relief. Now, I'll tell you, this is not a cure. This does not cure PTSD. For you guys, float rest is not going to cure PTSD, but it does make it easier to tolerate therapy. It is hard to go into therapy when you are super activated. It is really hard to do therapy when what you're talking about makes you super uncomfortable because your heart rate's up, your blood pressure is up, you feel sweaty, you just want to run like hell out of the room. So if there are things you can do, propranolol is a medication does that, it modulates sympathetic tone. If you can get that from float rest it makes therapy easier, and you can dig a little deeper and you can process more, then that's the benefit. Right? If you can get more out of the treatments that are available to you, that is significant.
Yeah, that's why I think a lot, the integration from the therapy, like,
Yes, yes. Yeah, we're not doing this through, we use it at the center, not because we want people not to need our services. We do it because it really does help people to use the resources at the center more and better and to tolerate it. Because it's super uncomfortable to have sympathetic tone. I mean, that's what people will literally almost do anything to get rid of the anxiety. They'll use drugs, they'll use porn, they'll eat themselves sick to decrease sympathetic activation.
You can stop me, Matt, if I'm starting to go over, but I apologize. I missed the first couple minutes. I know that you're working with Maui Calm now, but are you still actively doing research, or is there someone else actively doing research in this space?
So Maui Calm is going to be doing the research. We are going to be doing more active research in this space. I am not
Okay.
at the center anymore, but the center wasn't researching the float rest, but we have been using float rest
Okay.
for years and years and years. So it is one of one of the first interventions that we started to use. We've been using, like I said, float rest and stellate ganglion blocks.
But so, like, using the verbiage that there is like active research happening on first responders and rest, it's happening through Maui Calm, and you're helping facilitate that.
Yes, yes. So we're looking at first responders. Maui Calm's going to be doing that work in Lahaina for the fire
Okay.
victims at Lahaina.
Perfect. Thank you.
Yes, yes. Anybody else? I'm very happy to go over a little bit if we need to. So, because we kind of started a little bit late.
I think when I start making a document, all of a sudden questions will come to me.
Yeah, no, that's fine. And you have my contact information, so it's perfectly fine to reach out. And remember, this is a teaser. The real information will be in September's. I'll have a few more videos and a little bit more information, a little bit more of the probably some of the science stuff, but it'll be
Yeah, I'd
similar.
love to. I sit on the board of the FTA, and I think I'd love to collaborate with you on something that we could already say that you've generally looked at that then we could give out at the float conference or to our members
Okay.
when September comes around.
Okay.
Mandy does the public awareness, so kind of public facing content
Right.
for the FTA, and I do the content and education, which is more like internal for float center owners. So we've been talking a bit about creating something, that could be a resource in our database for our members to have access to.
I
So,
think it is
man,
important. I think, yeah, having a pamphlet of some kind, a little trifold or something like that, would be something good to get for float centers to have. Something for people to take, something to have, at a fire station, have it on their bulletin board. If people are interested. They like pretty colorful things. Who
yeah, we could
doesn't?
easily make a
I like them
template that
too.
we could easily make a template for a brochure or a one page that could be
Hmm.
rebranded by any float center, and
Hmm.
put their colors and logos on it and make it for
Yeah,
them with
yeah,
good looking those high level points. And then
yeah.
yeah, and then going in and educating, like going in and talking, like I don't know, I would like to think that they would open the doors and have a I was at a city wellness. Not many firefighters didn't really come through, but it was like for employees of the city down the street that, but it was everybody from like landscapers to the accountants to,
Right.
all different employees coming through.
Yeah, I think, it's interesting because I think float rest is it's a very interesting design because it's good for immediate disasters. Something happens and you want to immediately go in and kind of modulate the sympathetic tone, sort of almost prevent PTSD. It's good for this first responder group that already is going through it, already has that really high sympathetic tone. And it also is good for college athletes and Olympic athletes and people who and like the group of people who want to maintain their who are who are at risk for burnout, like physicians and pilots and people who want to kind of maintain their high performance. So there's like these really interesting groups that float rest kind of targets. And in a way, the firefighters, first responders are in the between. They need to maintain that really high um, capability uh, and flexibility and ability to make decisions quickly, but they're also in that disaster. And they also have that high CNS. So they have all of them.
Yeah. Yeah, it's a unique group. I mean, we talk about our achievers, which is like as one of our customer avatars, which are the lawyers and doctors and athletes that are dedicated. But yeah, firefighters are unique because they're that, but they're also public servants. And
Right. But I mean, if you think about it, why is it important for doctors to use flow? Because they need to make important decisions. Well, a firefighter or an EMT has to make a life or death decision under pressure, uh, follow a protocol, make sure they're make math decision, like how to dose a medication under stress. That's really, really important. And they're athletes. Again, most of them have to stay physically very well, have to maintain that while their body and their brain is fighting against them, making their blood sugars too high and their cholesterol too high. So there's really a place for this when it comes to their physical well-being as well as their emotional well-being.
all right, anybody else want to chime in? We've had some new names pop in, listening in here.
Hi, Wade.
Wade's a newer ad.
Do you have any?
Hey, Dr. Abby. Hi.
How are you? Thought you could sneak
good.
in, huh?
Yeah, I'm wonderful. Did I come in like super late? Did I was an hour? Because I feel like it just started 6 minutes ago. That was the time I had, and I feel like I'm way late.
6 o'clock.
6
6
o'clock Eastern.
Central? Eastern. See, that was a problem. I did Central, which was like 6 minutes ago. But I did miss that. I heard you just dropped that you left the center. What are you doing now? Out of curiosity.
I am doing a couple things, but I'm working with Maui Calm, which is I'm in Maui.
Oh, nice.
I'm working with Maui Calm that works with bringing float and float research to the fire victims of Lahaina.
Oh,
Yeah, 10 years, Wade. It was enough.
yeah, for sure. I went 3 times, but then I'm a psychedelic integration coach now for the Casey Scuden 343 Fund.
Okay.
It's helping provide safe and supported access to ibogaine for first responders.
Okay, I won't go there.
All right, just putting it out there.
Yeah, Abby, a group. I don't know if you're familiar with them out of Virginia, but I'm here in San Diego, and we partner with the Virginia High Performance that works with the Navy SEALs here on base. And we've got an incredible business-to-business partnership with them. And, we can't save any of their information. We can't text them or email them afterwards, but we see them like 14 times before they move on to their next series of the Virginia High Performance system. And it just kind of fits in with everything that you said today.
Yeah. Well, good. I'm glad. This is like a new kind of talk. I'm used to talking to firefighters or to people about sort of firefighters in a different way. This is my first float talk, so I'm glad it was helpful.
It was helpful for us. Thank you.
Good.
Yeah, anybody else chime in? And I'll just comment that it means, so much to me as someone who is committed and dedicated so much to helping bring float to the world and help people with it, that you have chosen to leave such a, with your pedigree and experience, have chosen the transition you did to work closer with flotation therapy and helping us spread the message. So, I have my days as a small business owner. I'm like, what am I doing? But then, we're doing good work. We're really helping people, and just the act that you've taken to, transition towards focusing. You've experienced so many different modalities, and you've chosen, Maui called. So, I mean, maybe it's location as much as that
dang Justin Feinstein. He's too personable.
Yeah. And Dr. Feinstein there, but it's just,
there are very few interventions.
Yeah.
That are as science-based, that have as few side effects, that can do as much good. I love stellate ganglion blocks. They work. They really, but they're invasive and they're painful. And it's hard to get repeats, and it's hard to, find people who can. You have to have someone who's really trained in doing it. You have to really trust your doctor who's going to stick a needle in your neck near your, carotid artery. And it's, but they work. I mean, they're fabulous. But this is something that can be done much more easily. And the point of Maui Calm, of course, is that it can be mobile. We can now take float tanks with us in a shipping container. and bring it to disasters. And so if we can do something that doesn't need a prescription, doesn't need somebody who's really super trained to provide it, doesn't have side effects, isn't a drug. I know ibogaine and all that other stuff is, hey, that's great, but it has side effects. It has possible things that people can die from. And the same with medications that we have. But this is something that's pretty safe, that can now be mobile, that can be taken around, that has these really important effects. And that's something I can get behind. And it's really been an interesting, that's what I'm getting behind at this point. So, so that's where I'm coming from.
We need to dilute that down to a nice, concise quote there. I love that. Yeah, what Justin's doing with his concept of like the world saving kitchen, world central kitchen for mental health, and being able to go into war zones and disaster areas, and the concept of maybe not being able to cure PTSD, but to be able to prevent it with early deregulation of the nervous system after the trauma is just like gives me the chills to think about.
Yeah. Well, the World Central Kitchen idea he and I had discussed that. That kind of came about us talking about it, going, well, wouldn't it be great? And then Jose Andres, actually, my sons went to high school with his son, and he's here locally. And so part of us was like, well, let's talk to him. Like if we could team with him, like literally team with him as a World Central Kitchen, and just bring mental health with him when he goes to these disasters. I mean, it seems like a big reach, but it isn't. It can happen.
It makes a lot of sense. I think getting that in front of the right people, it makes sense.
Yeah. So should be continued.
Yeah. Well, thank you again, Dr. Morris, and thanks everyone for joining us. You can, this is recorded. I saw some questions and some people that joined late. This is recorded. This will be available. You can find previous recorded webinars, and this will be there. Give us a little bit of time to get it up. Floatation.org/webinars. You can hear much more from Abby. This was just a teaser. She's one of our keynote speakers. I'm very excited to be bringing to Float Conference this year, so you can hear more in a deeper dive with Dr. Morris at Float Conference, September 18 through 20 in Norfolk, Virginia. If you haven't gotten your tickets to Float Conference yet, get them soon. The price is about to go up. We're in our early bird phase here. It ends at the end of April, so last day or two. Today's the 30th. Today's the last day to grab your early bird tickets. This webinar was open to the public, so I don't know that everybody here is an FTA member, but if you are an FTA member, it is an additional discount in there. So find out about that. So grab your tickets. We can't wait to see you there. Next month's webinar will feature another speaker from our Flow Conference lineup. So that's what we're going to do over the next few months, is feature the Flow Conference speakers. So keep an eye out for that announcement coming soon.
Thank you, everybody.
Thank you, Dr. Morris. I'll be in touch. Have a great day.
All right.
Enjoy the East Coast.
Bye.
Bye.